Good morning, everybody. Hope you're having a great week so far. Welcome to today's episode of Tooth Teacher Tuesday, and specifically another episode of Oral Pathology Corner. I'm your host, Dr. Steven Zahm, and today we're talking about a certain pathology. Pathology may not be quite the right word, but what I'm going to talk about today is something called tetracycline staining. And what I mean by that is, as you'll see in a second, a lot of people are obviously worried about the cosmetics of their smile, and that might be the size or the shape or positioning of their teeth, but also, kind of that ideal smile, that Hollywood smile that a lot of us would like to have, means we want to have bright white teeth, and which is usually pretty achievable. But with tetracycline staining, basically what that is, I think many of us are probably at least somewhat familiar with tetracycline. It's a pretty strong antibiotic that, like any medication, can have side effects. And one of those side effects can be if you're given tetracycline as a child, there's a chance, it's not a guaranteed thing, but if your teeth are still developing when you're put on tetracycline, what can happen is that it kind of messes with the formation of the teeth and kind of creates this very distinct staining, hence the name. And that distinct staining looks something like this. And the trick with tetracycline staining is, for most people who want to whiten their teeth, a lot of times different bleaches and other whitening agents can do that. If it's staining from coffee or tea or wine, or just the natural darkening of the teeth with age. But tetracycline staining is very deep-seated staining. It is something that typically does not respond to any kind of bleaching or whitening agents. And so anyone who has tetracycline staining, if they want a whiter smile, because whitening is off the table, a lot of times the treatment for that, again, this is more cosmetic than it is functional, but the treatment for that would be to do some kind of veneers or crowns on the front teeth that are just going to sit over top of the teeth and hide those stains underneath. Because again, trying to whiten isn't going to get those stains out, so the alternative is to just cover them up. So, like I said, not a true pathology, so to speak, but it is a relatively common dental finding, and one that, by no one's fault, they just end up with these stains and can be a little bit tricky to achieve the cosmetic outlook that they're looking for. So, hope you found this interesting and useful. If you have any questions or comments or suggestions for future episodes, please let me know. Otherwise, thank you for tuning in, and we will see you on next week's Tooth Teacher Tuesday.